Look, I wanted to welcome everybody this morning. Thank you for coming. We understand, of course, that you didn't have a choice and that you're actually being paid for this, and it's actually during the workday. And part of the reason for that is because compliance is something that we should incorporate in every single thing that we do. So when we're verifying benefits, when we're out doing cases, when I'm reviewing contracts, I mean, we should all think of these things sort of with our compliance hat on, and that's why we think it's really important to almost shut down, for a substantial part of the day to go through this and refresh ourselves. Obviously, part of this is about compliance with the OIG and our corporate integrity agreement, but a bigger part of this is just operating in accordance with our mission and values. And so, we can't stress enough the importance of this and following this. So I would really encourage everybody here to obviously pay close attention. I realize that over the course of 3 hours that your attention may wax and wane a bit, but we'll have some regular breaks, as Julie said. But it's really important, and to the extent that you have questions or issues or thoughts, please, this is a perfect forum for sort of getting them out there and discussing them. So without further hesitation, I will introduce our Chief Compliance Officer to start us.
Thank you, Bruce. Okay, I know what you're all thinking. What? Not this again? Yes? Yes, we are back here today because compliance training is an important company obligation under our corporate integrity agreement with the Office of Inspector General, or the OIG. But even if we were not required to hold mandatory annual compliance training, we still think that compliance training is important. And understanding federal and state rules and regulations that impact our business is a necessity in today's ever-changing healthcare environment. It can be daunting and overwhelming to keep up with the myriad of rules and regulations that we need to comply with in our day-to-day activities. Under the many changes in healthcare reform regulations, healthcare providers are struggling to understand the impact of healthcare reform on their organizations. Compliance programs have become an integral part of healthcare provider organizations and will become a requirement for all providers who bill Medicare and Medicaid in the near future. So compliance is going to be a requirement for everyone. Read all about it. Every day, one can read about federal government's increased focus on preventing and deterring Medicare fraud and abuse around the country. In 2009, the Department of Justice, along with the Department of Health and Human Services, HHS, joined forces to create the Healthcare Fraud Prevention and Enforcement Action Team called HEAT. HEAT focuses their efforts to prevent and deter fraud and to enforce current anti-fraud laws around the country. They have set up Medicare strike forces in 9 cities, including Chicago. They have charged healthcare companies and individuals with various healthcare fraud-related crimes, including conspiracy to defraud the Medicare program, criminal false claims, violations of the anti-kickback statute, money laundering, and aggravated identity theft. The charges are based on a variety of alleged fraud schemes involving various medical treatments and services. Federal officials are working to ramp up their enforcement of existing medical privacy rules. Federal officials are also starting to target individual executives in healthcare fraud cases. Recently, it was reported that a Connecticut doctor will pay $2.2 million to settle government allegations that he billed Medicare and Medicaid for services that he did not perform. A doctor in Houston was convicted in a Medicare fraud scheme, and the list goes on and on. These were just a couple examples that, when I was working on putting together the slides, that I came up with. But literally every single day I get emails sent to me from the OIG which summarizes some of these cases. So the heat is on and we have felt the heat. Next slide, okay.
That was part of the.
Yes, the heat is on, and we have felt that heat.
I'm impressed.
United entered into a settlement agreement with the OIG, as you'll recall, on July 8th, 2010, and also signed a corporate integrity agreement, which is called a CIA, with the OIG. United was required to pay the OIG $7.3 million. The OIG alleged that by soliciting and receiving payments from hospitals in exchange for patient referrals, United violated federal anti-kickback laws. As part of our obligations under our CIA, we are required to hold annual compliance training like we're doing today every year for the next 5 years. In fulfillment of this obligation, we are going to have 1 hour of general compliance training, which will include a review of our CIA requirements and United's compliance program, and 2 hours of arrangement training that will cover a discussion of the anti-kickback statute and Stark Law, obligations for all United personnel under our compliance program and CIA agreement, our arrangements tracking system, the policies and procedures related to our arrangement tracking systems, arrangements that could potentially violate the anti-kickback statute or the Stark Law, and some examples of violations, and some penalties that you could have for violating the anti-kickback or Stark laws. First, let's review our corporate integrity requirements. Who does the CIA apply to? It applies to all covered persons as defined as all United employees, officers, directors, managers, even to Dr. Norris and to Dr. Rubenstein. It applies to all leased employees, PRN employees, contracted employees that work more than 160 hours in a calendar year. It applies to all United physician investors. All future and current members of United Urology Centers are lithotripsy company. Some of the obligations in the CIA apply to a lesser extent to our physicians. For example, our physicians are not required to have annual training. However, we are required every year to send our physicians a letter that describes both our CIA and our compliance program. We've also made our CIA, our compliance plan, our code of conduct, and pertinent physician policies available to all of our physicians on our website with the physician access section. What is the scope of our CIA? It applies to all arrangements, and arrangements are defined as every arrangement or transaction that involves directly or indirectly the offer, payment, solicitation, or receipt of anything of value and is between United and any hospital actually or potentially receiving referrals from United or from United's physician investors. It also covers focus arrangements, and focus arrangements are defined as every arrangement or transaction with the respect to the provision of green light laser and ESWL services, including providing equipment, supplies, technicians, and related items, that is between United and any hospital located in Illinois, Indiana, or Iowa, and that receives referrals from United or United physician investors for ESWL, XPS, HPS, with green light laser services. The CIA requirements, long laundry list of our requirements under our 38-page CIA agreement. The obligations include a written code of conduct. United has always had a code of conduct, even since the inception of the company, but we've had to expand that. Policies and procedures regarding the operation of United's compliance program, training and education, which is what we're doing here today, focus arrangement procedures, focus arrangement requirements, the engagement of an independent review organization or an IRO to provide reviews of our systems and an audit of our arrangements, a disclosure program so that employees and physicians can identify any issues or questions associated with United's policies, conduct, practices, or any other issues with respect to a federal health care program that's believed to be a potential violation of the law or United's compliance program. We need to have a process for screening ineligible persons and we do that against the OIG GSA exclusion list to ensure that United does not bill a federal health care program for items or services furnished by excluded persons. We have an obligation to notify the OIG of any investigation or legal proceeding by the government or any other agency for fraudulent activities. We have a policy for reportable events reporting, notification of moving or closing locations or business units. So for example, when we relocated the billing office and the administrative offices in February, I had to notify the OIG of that relocation. We also have an obligation to provide reports to the OIG. Our first report that we needed to provide was our implementation report. It was due in November. And now we have an annual report that will be due in September that we must report to the OIG for the next 5 years. So it's a long list of obligations under that CIA agreement. One of the obligations and requirements is that we have a compliance officer. We've always had compliance officers. In the past, we've had 2 co-compliance officers, Eva and Patty were our co-compliance officers. But as you know, I have now taken on the full-time responsibility as compliance officer. Most of you know me, but my contact information is listed on the slide, as well as posters that you may have seen. We've had posters in the fixed sites, in the garage, and there are posters with my contact information in the billing office. My responsibilities as compliance officer include development and implementation of policies and procedures and practices designed to ensure our compliance with our CIA, the training and education of our staff. You will see that I've added a compliance corner column to the employee newsletter and the physician newsletter, and the compliance column is a way that I can communicate different questions that I've received from physicians or staff with compliance issues, or any press releases or court cases or OIG advisory opinions that I come across that I want to communicate that I think impact our organization. So that's something that we've added to educate staff. The CIA requires the compliance officer to have active interaction with the managers. Anyone who's ever worked closely with either Dr. Norris or Dr. Rubenstein knows that that is no problem for me. I must periodically review our focus arrangement tracking system, review the focus arrangements to ensure that our policies are followed, and I must file reports with the OIG. I already mentioned we have one that's coming up in September, so that's another obligation. As a compliance officer, I and our managers were required to certify that United is in compliance with all requirements of the CIA unless an exception is noted in our report. United has implemented procedures reasonably designed to ensure all focus arrangements do not violate the anti-kickback statute and the Stark Law, and we must certify that United has fulfilled the requirements for new and renewed focus arrangements. The managers must review my report, and they must certify that they've made reasonable inquiry regarding its content, and they believe that the information in the report is accurate and truthful. So all the 2 managers and myself, all 3 of us, are required to certify that our report that we're submitting is truthful.